Hi everyone, I'm Dr. Alan Miner from Health Quest downtown Albuquerque, and we're going to talk today, show you how we adjust little newborn infants. And in particular, this case, Jessie brought her little baby Gigi in when she was first born to get checked out, but she's been suffering from reflux. We're going to show you guys how we adjust a baby with reflux. What have you been noticing when you adjust her? When we adjust her, what happens?
Every time we come home from an adjustment, for the next couple of days, she is so calm. She's not choking or spitting up. Her feedings are much better. She's happier when she's adjusted. It makes life a lot better.
Okay, cool. So I'm going to have you lay down right here for me, Jessie. And so let me explain how the concept here is pretty simple. There's a few different things with newborns and babies that can impact reflux. One of the first things when babies are spitting up a lot and having reflux problems is we ask the mom to cut out dairy. That tends to make a big difference right away. Also, I'm going to warn you, most of the reflux meds that get prescribed to babies have never been tested on babies, so we want to do everything possible that's natural to help your child be more comfortable. Now, what we do with the adjustment is we want to get the spine moving the way that it should, particularly the nerve supply going to the digestive tract. And so the first thing we're going to do is hold a contact down here on the ischial tuberosity. And what you're going to watch with little Gigi is how she almost starts stretching herself out, adjusting herself. You'll notice how her spine kind of waves and moves and stretches. She moves her head back and forth. This is a little ligament that goes between her hip and her sacrum. And we can just kind of get her almost adjusting herself and working out that back. It's real common when babies have been constipated after we adjust them that they have a poopy diaper almost immediately. Then the other thing is this atlas right here, C1. We want to make sure that's nice and in place. And sometimes when the babies are coming through the birth canal, and if there's been any pulling on the child, it can create some stress and damage in those upper ligaments. So we want to make sure that neck's nice and supple, those muscles are nice and relaxed. And then for babies, we'll typically, if we need to do an adjustment, I'll just do it with my pinky right there. Very quick little impulse, hardly looks like anything. Sometimes people have a image of people adjusting infants as though we were adjusting, a 50-year-old ex-wrestler football player, which isn't the case. And then sometimes we'll also use a little handheld instrument to deliver a little impulse on the child. And sometimes if we need a little extra help moving things, we can do that as well. We tend to do that through the finger. But that gets the bone moving, gets the nerve called the proprioceptor at that level firing up to the brain, and again just gets motion back in that spine so that little baby's working better and we get a poopy diaper. That's how we do it. If you're ever having problems with your infant, your child, your grandchild having digestive problems, chiropractic's a really natural solution.